All right. Good evening, everybody. Thank you so much for joining us this evening. We will get started and let people start to trickle in. But just to start, thank you so much for being here. My name is Jessica Richmond. I am one of the webinar co-leads of the organization called FuturePedsRes, which was kind of born out of the COVID era to help future pediatric ERAS applicants joining the pediatric residency and future workforce, get more information, and work with different organizations that are all part of the process that helps students get into residency and beyond. So we are really, really thrilled to have you all join us here tonight for our first of our kind of few month long webinar series that we host each year. So just happy you're here and thank you for joining us. And I'll let my other e-board member introduce herself now too.
Hi, everyone. My name is Morgan. I'm also a member of the FPR board. We probably will refer to it as FPR instead of FuturePedsRes, in case anybody gets confused with that. I am one of the co-directors this year, along with our other co-director, Mahima. We have another webinar lead as well, Banu, who's here. So really appreciate everyone coming out to our first webinar of a long series, which we'll discuss later. But this one should be really helpful just as an overview of the application cycle. And as many of us are third or fourth years, soon to be applicants as well, we're always learning alongside you. So we're excited to go through this journey together.
All right. And just we're very, very lucky to be joined tonight by three wonderful panelists who have donated their time to be here, give a lot of insight, and they will be hosting a Q&A session at the end. So please stick around for that, and we'll also have the opportunity to enter questions into the chat. But we are joined by Dr. Megan Ayler, Dr. Monique Nafee, and Dr. Elizabeth Conser. So thank you all for being here. Thank you to our panelists. And without further ado, let's get started.
So as stated, these are our co-directors. Again, my name is Morgan. I go to Penn State College of Medicine, and then we have Mahima as well. She's at the Carle, Illinois College of Medicine.
And then again, my name is Jessica. I attend SUNY Downstate College of Medicine, and Banu is my co-webinar lead. So we are kind of the operation behind all the webinars that we are putting out to hopefully get some information out there and answer some questions as everybody starts to go through this process.
And then we have a lot of support in the background. Dr. Dell is one of our advisors. He's located at Case Western Reserve University School of Medicine. So he does a lot of work as well with the Association of Pediatric Program Directors, or APPD. And then we also have our associate at APPD is Colleen. She's really helped us get everything set up and does a lot of behind the scenes work that we're very thankful for. And then our other director, advisor, excuse me, is Dr. Thompson. She is located at Boston University, and she as well has provided tremendous support thus far this year. She will continue to provide more, so a great resource in case people have questions or have any concerns.
So without further ado, I'm going to reintroduce Dr. Megan Ayler, and she is the president of the Association of Pediatric Program Directors. And she will be speaking on the next few slides just about some important points about the application process and important things for applicants to know. So without further ado, go ahead, Dr. Ayler.
Thank you so much, Jessica, and the FuturePedsRes team. It is really a highlight for me to get to connect with FPR and with this incredible pediatric community and future pediatricians. Recruitment season is such a fun and exciting time. It represents this new birth of the best and the brightest coming into our field. And so I first want to say, welcome to pediatrics. You've chosen the best specialty, and we are so delighted that you are joining us. I'm really thrilled to speak on behalf and welcome you on behalf of the Association of Pediatric Program Directors, which Jessica mentioned is a group of pediatric leaders in medical education that comprise really the entire continuum of learning. We have trainees who are still in residency, chief residents, program coordinators, residency program leaders, fellowship program leaders, and we represent a group of educators and learners that are committed to this mission that you see, which is to ensure the health and well-being of all children. We lead the advancement of pediatric medical education, the development of a sustainable and diverse workforce, the cultivation of an inclusive learning environment, and the promotion of educational innovation. We're more than 4,000 members at this point, representing over 200 residency programs and over 800 fellowship programs. And I highlight this just to let you know, as we move through and understand some of the recommendations, that this is really a very united voice in the pediatric community. APPD works in a lot of different ways, and I want to get to work on what you all are most interested about. But within our many branches of work that we do, working on development of programs and members, and working in collaboration in a leadership capacity is really key to what we do, as well as leaning on research and scholarship to inform recommendations. I think all of these play into the way that we developed our recruitment action team. So I'll invite you to go to the next slide. As FPR was in its early stages in response to the COVID pandemic, we were busy on the program side as well. Everyone probably remembers that things were really turned upside down, and the old way of having applicants fly from all over the country and the world to many places to interview obviously had to be really reconsidered. And so we pulled together APPD, this wonderful group of collaborators with FPR and Next Gen Peds being critical student and applicant voices in recommendations. This group also is represented by ComCEP, some of the partners on here, as well as our department chairs. And we gathered this group of leaders together 5 years ago, it's been now, to offer recommendations to our community of sort of best practices for moving forward. This team was called an action team because when it was first formed, we thought, you know what, we just need a short-term group of leaders to come together, give some recommendations during this time of crisis. And really what we have realized is that this has developed into a collaborative learning community together, a group of problem solvers that is able to adapt with the evolving needs of applicants and program leaders, and to come to consensus on an annual basis on recommendation to our pediatric community and to our applicants specifically. You can find the guidelines in full, but there's a nice summary and with this QR code right here, or you can just Google APPD recruitment resources or APPD residency recruitment. I go to it frequently as a program director and as APPD president. But this represents work from a group of people, including student voices, to come to a set of recommendations for our community to really lean into. And I want to highlight some of the key recommendations. Again, this is several pages long, and I do encourage you to take a look at some of the content, but we tried to summarize some bullet points. For the programs, I will just touch on a couple of things that I think are important for you to know. First is that we will offer virtual interviews. This is the recommendation. There is also a recommendation for programs to extend interview invitations no earlier than Monday, October 6th. The reason behind this is we as a pediatric community feel very strongly about holistic review, ensuring that we are looking at all that applicants bring to us, not just at a single grade on an exam or on a rotation. This does not mean that we have a universal release date, but we do recommend no earlier than October 6th. We also recommend that programs accept both USMLE and COMLEX and not ask for DO granting schools, for applicants applying from DO granting schools to have to do both USMLE and COMLEX. That's for purposes of equity and saving you all money. That is the recommendation. There's also a recommendation as best practices for us to not invite 200 people and only have 190 spots available to schedule. So holding ourselves accountable to supporting you all and not feeling like you have to move quickly, otherwise you're going to lose an opportunity. And to give reasonable amount of time for you to respond to an interview invitation. I'll talk a little bit more when I speak about the NRMP voluntary role block pilot, but we have recommendations that if programs host in-person visits or second looks after interviews have concluded, that they participate in the voluntary role block pilot. And I'll talk a little bit more about that later. For you as applicants, there is a strong, strong, strong recommendation that you listen to your advisor. If there's anything you walk away, it's trust your advisor. They are smart. They will guide you in the right direction. It is really tempting when you are in medical school and you are talking with colleagues and they may be applying to very different specialties that have different guidelines, to be tempted to say, oh, my colleague in ENT is applying to 70 programs. I need to apply to 70 programs. Please, please, please talk with your advisor. With that in mind, there is years and years of robust data to say that the probability of matching in pediatrics approaches 100% with a final rank order list of 10 to 12 is conservative. Honestly, it's even fewer than that for most years. And so as a broad general recommendation, most applicants do not need to apply to more than 20 programs to achieve this goal. Now, again, listen to your advisor. If you have if you have had some academic remediation, if you're couples matching, there may be exceptions to this rule that may be unique to your situation. So please work with your advisor. But in general, it is few people that need to apply to more than 20 programs and then interview at more than 10 to 12 in order to get that final roll of 10 to 12 programs. Applying to more really stresses the system, and it stresses you. If you are in a good position to apply to 20 programs and interview at 10, but you increase it to 40 and 20 out of anxiety, it's a huge burden of time for you. You are doing sub-Is during this time. You are on your rotations and meant to be learning all about medicine, and every interview that you spend is time away from that patient care. It's a stress to prepare. It really can add up. And when you're applying in ERAS, it also can cost real dollars to increase the number of spots that you're applying to. So again, do talk with your advisor, but there is such strong data to say you do not need to over apply. And in addition to stressing you out, it also adds huge burden to the system. If I get an application that's somebody's number 40 out of their 50 places that they are applying, it's really hard to apply that holistic review in an overburdened application system. As you probably know, you will have 5 signals to use in ERAS to indicate interview preferences. So the places at the start of interview season that you think are your top 5. It can be really tempting to sort of want to game the system, but I would have an honest reflection and think about what are the 5 places that I would be really, really upset if I didn't get an interview of all of them, and to use those signals accordingly. We recommend that applicants we understand you're not going to want to interview likely not going to want to interview at all the places that you apply. That is totally fine. That is expected, and residency programs account for that. You should, however, make sure to decline in a way that is professional and isn't harmful to other trainees who may be interested in that position. So if you are offered an interview and you decide, I have now 15 interview offers and I really am actually not that excited about this program, we recommend, if the timeline is aligned, that you withdraw from the interview by November 15th and or provide a minimum of 2 weeks notice to cancel or reschedule. And the 2 weeks is really important because residency programs are working very hard to pair applicants with faculty interviewers to ensure that we have a day that is set up to give a good showcase of the program to see if it's going to align with your learning goals, with your values that you are seeking in a program. And late cancellations make it such that that position, that interview slot is not able to be filled by someone else. So we really request strongly that if you are going to cancel, that you do so with that 2 weeks notice. Again, recognizing it is totally normal to not accept all of your interview offers or to accept some and decide that you're going to cancel them. We also know that some interview offers may come out after November 15th. Some people do a rolling. So if you accept something on November 16th and it's for January and you decide in late December that you actually aren't interested in the interview, that's okay. Again, the 2 week notice. Our community wants to make it clear that activities like this, webinars, open houses, in-person visits, any second look, any program sponsored events are optional and intended to help you learn more about programs. It can be tempting to think, oh gosh, a program is offering this virtual open house. They're offering an in-person look. If I don't go, is that going to reflect poorly upon me as an applicant? And the answer is no. These are for your benefit. And again, I'll speak a bit to the voluntary roll lock to really underscore how committed we are to sending this message to you. And then finally, this is same for both programs and applicants. We really don't require any post-interview communication. It can be stressful for you all, stressful for programs. There are some exceptions. If you have a question, if you want to thank somebody specifically, by all means, but we don't want to get this stressful back and forth of the program says it was great to meet you. You say, thank you so much. They say, of course, et cetera, et cetera. Programs want for their interview day to sort of stand alone as well. Next slide. A few highlights for the ERAS application. Some of them will be kind of underscoring what I just shared. So I mentioned that there's a do not offer recommendation to not offer interviews before date, but I really want you to be aware that we don't have a universal release date like some specialties. So if on July 6th, your favorite program has not issued an interview, do not panic. There is a good chance that they are still in their review process. And again, this is for the purpose of equitable review, holistic review, and we continue to recommend virtual interviews as a action team. We have good data that this is more equitable, that it is more environmentally conscious, that it is huge cost savings for you all, minimizes time away from clinical responsibilities, and allows you to see what you need to see. There's good studies that support that you are able to get a really good look at what the program has to offer. I think I already quite underscored the fact that most applicants don't need to apply to more than 20 programs. And I'd like to spend just a moment, and I know we're getting tight on time, but just a moment to highlight the NRMP voluntary rank order lock pilot. This is a pilot that is happening with the NRMP. So you probably are aware, but I'll just be explicit. ERAS is an application system. NRMP is the match system. You have to register for both. If you interview at a bunch of places but don't put a rank list in, then you won't get matched because you didn't put a rank list in to match you. So NRMP has developed this lock pilot for the purposes of allowing for programs to host in-person second look visits for candidates who may be interested in visiting a campus and being able to see the institution after interviews have completed, with that assurance that it's not going to impact your order on the rank list. And participating, there are 3 specialties: vascular surgery, internal medicine, and pediatrics are the 3 specialties that have been selected for the pilot for this academic year. What we are able to do is individual programs can opt into this, and they will be able to lock their rank order list in a way that's transparent to you as the applicant before their first in-person visit. So for me, I am hosting interviews in middle of November until the first-ish week of January. I have about 3 weeks of time to pull together my rank list. My rank list gets locked as soon as the first day of the NRMP opening up the rank list. It is locked in a way that it is really locked. I can't go back in and uncertify that list. It is immovable, and the NRMP will not allow me to change it. There, though, is a window then of 3 weeks of time from when I've locked my list to when you need to lock your list. And so you can know, if I want to come check out Megan's program to see what Portland's like and how rainy is it in the winter time, you can come knowing that whether you attend or don't attend, it's not going to have any impact on where you are on my list. Pediatrics tried really hard to get into this lock pilot first wave because we wanted you as applicants to really understand that the in-person visits are truly for your benefit and won't have any positive or negative impact on your position on the list. Next slide. So there are lots of resources that are out there for beginning your ERAS application. Probably the most important one is just the My ERAS website that has so many resources for how to navigate, what to do with geo preferences, and how to populate your impactful experiences or your meaningful experiences. I would also certainly recommend that you connect with your advisors as you're pulling your list together, as you are putting together your application. In addition to these many resources, finding a friend, finding somebody who can help you proofread your personal statement, your My ERAS application is really invaluable. They don't need to be in medicine. And with that, we have lots of other resources on appd.org. You can follow us on X as well. And again, we're so thrilled that you all are joining our pediatric community. Pediatric residency program directors, I think, are a pretty fun lot of people to spend time with. And so we're so glad to welcome you into our community.
Totally agree. Megan, can I make one comment? Just to connect all the dots, because this happened to us last year. So because for those of us participating in the LOCK program, which I already registered my program to participate, that means that you guys have to have your step 2 scores to us prior to the lock date, because many of our, I think most programs, like our GME office, our DIO, will not allow us to list anybody who hasn't passed step 2 on our rank list, because in Oklahoma, you can't get a medical license without passing step 2. And you only get 3 attempts, I think, is the rule. I suspect many of the states have that rule, but I know in Oklahoma it's 3 attempts. So just for you guys who still are planning to take step 2, you do not have to have your score to us before you apply, but certainly we have to have a score before we lock our list to be able to include you on our list.
Thank you so much for calling that out, Monique. That will be the same for all PEDS programs participating in the lock, because I think most medical schools, in addition to state licensure, most medical most medical schools require it as a graduation requirement. So anything that is a graduation requirement, if you have a core rotation that is later on in the year, anything that is going to fall in that core required for graduation, you want to have that in by most programs will have something shared transparently. The lock list doesn't open until early February. So if you have a grade that's going to come in January, as long as you know that it's going to be in, that should be a safe window if a program hasn't been specific. But that is a slightly earlier timeline than I think people were used to operating on before. So thanks so much for calling that out.
We had several who had very last minute step 2 scores last year. I don't know what the difference was, but it was odd. And so I tell your friends, don't put it off. Just take the test and move on down the road.
Thank you both so much for that very informative information. I think it was helpful for me as an applicant, so I'm hoping that other people here tonight will find similar value in all of that information. So again, Dr. Ayler, you've already introduced yourself, but for our two other panelists, we would love for you to just do a brief introduction before we offer you all the opportunity to answer our pre-written questions for you all.
Sure, I'll go first. I am Elizabeth Conser. I am a general pediatrician by training, but my role is as a career advisor as an assistant dean for student wellness and advancement at Texas Tech University School of Medicine in Lubbock, Texas. I also have served as a clerkship director for 15 years, and my clinical role is in our resident continuity of care clinic. So I like to say that I like to sit on both sides of this equation and work with learners from the day they start medical school until the day they graduate residency and beyond. And so I really love to sit here and hear the program director's perspective, hear the advisor's perspective. It's a fabulous conversation, and I am excited to be here as part of it.
And I'm Monique Nafee. I am the program director and the vice chair of education at the University of Oklahoma Health Sciences Center in Oklahoma City campus. Go Thunder. And for Yay Thunder. Yeah. Anyway, we just in case people don't know, our basketball team won the NBA finals last night, and it was so exciting. Big parade planned for tomorrow. They're closing down all of downtown. It's going to be a total disaster, but it's okay. Anyway, I have been in medical education for a long time. I would say I've only been a program director for 3 years, but I was an associate program director for a long time before that, and love working with trainees. In my role as vice chair, I also get to work with junior faculty and fellows. And so I guess that's me. I'm a hospitalist for my clinical work.
Thank you both. So without further ado, I guess you could just continue.
Couldn't I?
If you could for us, how has the move to pass-fail for step 1 and COMLEX level 1 affected the holistic application review? And how has this shifted the emphasis towards research, away rotations, or any other elements of the application?
This is such an interesting question, and I sort of cringed a little when I saw you had assigned it to me, but I was glad I got the slides ahead of time. I actually think it's a really hard question to answer because I hope none of the Peds programs ever, I know we certainly didn't, looked at scores only, because I think there's so much more that goes into finding the right applicants for your program. Our program really tends to pick people that seem like they fit with us. For us, culture is king. We feel like our program has a really nice family feel and a welcoming culture. And Oklahoma City is a pretty down-to-earth city. It's relatively easy to get around. It's relatively inexpensive to live, probably similar to Lubbock, actually. And it's like in the South, so we got a lot of or at least in the Southwest. So we got a lot of opportunities for advocacy and things like that. So for us, we tend to choose to interview candidates who fit sort of those strengths, I guess, in our program. So we have always looked for things like I don't know, gold humanism is one for us if that exists on your campus, or a particular type of volunteer activity that perhaps you have taken on and kept doing. Like I know a lot of people mentor and mentor in many different settings, and so we always like to see sort of that strength of activity coming through. We actually have successfully brought several MD PhD residents through and feel like we do a reasonably good job, even though we don't have an accelerated research pathway as of yet. So we do tend to do things like that. I'm going to invite Megan and Elizabeth to comment here as well. But in my mind, know who you are and highlight what makes you unique, and those are the things that we look for. So I'm not going to lie and tell you we don't have an algorithm, but our algorithm is pretty in depth and looks at all sorts of things, including what did you talk about in your personal statement?
I 100% agree from the advisor perspective. So speaking to this and what I have seen, I agree. I saw programs doing holistic application review well before the move to step one pass fail. But what I recognize is that for students, the things they could control decreased, right? The controllables decreased and the numbers that they could provide could decrease. And so many of us in medicine just want to like control every little thing. And so I absolutely empathize with students in the situation of, well, now I feel like I don't have anything to put forth there other than a pass, which is a solid thing to put forward. And then many students are coming from schools with pass-fail grading systems, right? Which also frees up these things. And so it maybe is a combination of all of these things that has shifted students to potentially focus a lot on research, away rotations, and other elements, whereas programs still remain very grounded in their values and what they're looking for. And so I still think, much to what was spoken of, in the sense of knowing who you are and what you're about, and leading into what you bring as a future physician, a future pediatrician, and what you're excited about, you I do not want students to think, and I talk about this all the time, and we start this in year one in our discussions with our students, that a pass fail step means that in order to now apply to pediatrics, you have to go out and get 10 first author publications or something outrageous along those lines, when research is not your focus, for example. I would rather you lean into what you're passionate about within pediatrics and what that is. And then that is what programs, when they do their holistic review, will see about you and will understand. So I think you bring your whole authentic self to your application and to your interview. And program directors are fabulous at piecing that out, not only of your application, but in your interview. So trust them to do that well.
I totally agree with that. Be who you are. That's who we want to know.
100%. And I think when we had more tiered grades and when we had numeric step and level one scores, if I saw someone who had through the roof scores, everything is honors, off the charts, step one, but hadn't done anything else really to be an advocate, to engage in quality improvement, to do community service, to follow their passion, to do scholarship. That to me felt really sort of like a one-dimensional applicant. I know you're a really strong medical student, but what else are you going to bring to a program? And I think residency program directors have always wanted well-rounded pediatricians to come in that are intelligent and capable and intellectually curious, but also want to make the world a bit of a better place, whether it's through research, advocacy, all the many, many ways that you can engage. So agree completely with both of my colleagues.
Thank you so much. And then for the next question, similarly to what we discussed about personal statements being important, what makes a personal statement stand out, or what are common pitfalls to avoid? And if Dr. Iller wants to start.
Yeah. I'll be curious what my co-panelists have to say. I think that for better or for worse, sometimes the things that make personal statements stand out are actually the pitfalls to avoid. So in general, you want to tell a bit about yourself. You want to tell a bit about your passions. You want it to be thoughtfully written and to round out aspects of your application that maybe there's not as much clarity around. So, what was the spark that brought you into medicine and pediatrics? Perhaps in your selection of your 10 meaningful experiences, you didn't have an opportunity to weave together a story of how everything, how you went from being in the tech industry to going to Teach for America, and how you wound your way to healthcare and to pediatrics. Using the personal statement to tell that story can be really helpful. We really caution our trainees about trying to be, it's hard to do humor well. If you are not an English major, trying to get too creative and too unique can sometimes just backfire a little bit. So I would just use caution there. Don't feel stifled, but you're not necessarily trying to write a personal statement to stand out. You're writing a personal statement to tell about who you are and what you are passionate about. I think the pitfalls that I've seen are when you try to be too cheeky and it just doesn't hit well and can come off as unprofessional. Remember that everything that is in your application, this is a job application as well as people understanding who you are as a person. So you certainly want to be forthcoming about the road and the path that your professional life has had, and just using caution if you have had a personal traumatic experience that maybe really informed your choice to do pediatrics. How do you want to tell that in a way that balances being a vulnerable and honest applicant with perhaps sharing a level of personal information that is more than is needed for the personal statement. And then lastly, proofread, 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 proofread. So important. When I get a personal statement that says OSHU instead of OHSU or has a typo, it is just, it's not a deal breaker. It's not like we, put a mark, a scarlet letter on the entire application, but it's something that you do have control over. You have control over making sure that you have proper grammar, good spelling, all of those things. That's my advice.
I can go next if you want.
Oh yeah, go for it.
Totally up to you. But I would echo actually a lot of that. I kind of like a joke, but I don't want a joke per paragraph. Like I like one little sneaky joke in there that if I see it, I'm like, oh, that's good. That's a funny one. But again, it can't be the whole thing and it has to be in good taste. I agree with Dr. Ayler. I think sometimes people really work hard to be dramatic and tell like a creative story. And I don't know that you have to work that hard. Like literally, you guys, I want to know who you are. I promise who you are is good enough. And you're the person we want to know because really it's like I'm going to show you who we are as authentically as I can. And I want to know if you think you fit here. And then I want to know if I think you fit here, right? Like that's the goal. The goal is really to find the right fit. There are lots and lots of really great programs out there, and you can be a great pediatrician if you graduate from any of them. And so the goal is really to find the right one for you, which means you have to show us who you are. I also will say I really like it, especially if your application is a little bit confusing, that you explain exactly how the timeline went. Because sometimes in the ERAS application, the way it is now, I see the 10 experiences, but I can't exactly tell in what order or how they happened. And so then I will ask you about that on certainly on interview day. If I don't understand the flow of your career, I will ask you about how that all went down. So if you can spend a little time in your personal statement sort of saying why something happened, or how it happened, I think that is really helpful. The other thing I would suggest is somewhere in your application, if you've had some untoward event or if you'd had a gap in your training, please just say that and say why, because we're going to figure it out. We do this all the time. Don't try to hide it. If you hide it, it just makes it worse. We're going to figure it out. So just tell us. Everyone has had things happen to them, right? It's just we accept that life is challenging sometimes. And so just be honest.
Just one other, or maybe two quick things to add to that. 100% agree with all of those things. One thing that I say is a common pitfall to avoid is to really help these program directors out by not making your personal statement 5 pages long. I think that it is appropriate to keep it within normal length for a personal statement, right? And that would be around a page or a little bit more, but perhaps not much longer than that. I have had students bring me multi-page novels, and while I love that, you have to appreciate how many personal statements and applications these program directors read. And after a while, it is human nature for our eyes to glaze over as we read something. And I think the impact of that personal statement gets lost when it's that long. If you really want to have the most impact, try to do it with more brevity. Try to make it within that page, page and a half length so that we're not looking at multi-page personal statements. And then also to Dr. Nafi's point about sort of timeline and things like that, I recognize that there's individuals who are either watching this webinar or who are with us live right now who may be a late adopter of pediatrics, essentially. In other words, maybe you discovered pediatrics at the end of your 3rd year by surprise, and you are applying and are so excited to join, but have a lot to explain around that because your application maybe has other things on it or doesn't have as much pediatrics in it, so to speak. There are many people in our field that decided on pediatrics because they had an incredible encounter or experience during their clerkships at a time that wasn't early on. And we want so much to bring you in. And I promise while you're on the while you're in interviews, you will encounter others who are like, oh, I had that same experience as well. I think speaking to that in your personal statement can be helpful and will be incredibly well received. Others will be excited that you found us.
Thank you so much for all of that very, very helpful advice. I know as we all start to think about our personal statements as the next kind of big thing for the application. The next question is kind of piggybacking on what we'd spoken about earlier, but with interviews remaining virtual this cycle, how can applicants get a genuine sense of what a program's culture is like?
I think this is a great question. And much to what was referenced previously, Dr. Ayler spoke to the fact that we have years and data to show us that virtual interviews can allow you to see what you need to see, which is important. I would start this off by saying, first of all, understand yourself and what you are looking for in programs. And I think that will help you tremendously on this journey. This is a very self-reflective time of your life as you're putting this application together. But I think really understanding what type of culture you are looking for and trying to understand things like, would I thrive in, X program or Y program, et cetera, and trying to understand how that might work. So then once you know, hey, I kind of have a feeling of what I might be interested in terms of what would fit for me, then you can go out and start to do the things to get that sense. So that can start way before the interview day. It can start even before the application process. Thankfully, COVID brought about a very positive change in all of our website and social media presence for every program nationwide. And I am confident that you will be able to find the information you need on your research of websites and social media channels. And so I encourage applicants to go to all of those places to find that information. I say when you have time, which is, I realize in your 4th year at awkward times, sit down and start looking through some of these programs and their materials and their websites and those types of things. Look for things that you are interested in, shared interests, mentorship, advocacy, diversity. Start picking out the things that you are seeking out. Look for those program sponsored initiatives around wellness. Look behind the scenes snapshots that they often do on many social media channels. Residents involved in DEI work. Look at the community outreach. Find those things that speak to you and align with your values. And then when you get to the time when you're interviewing with the program, pay attention during interview day. Ask questions to really understand. There's always opportunities for you to ask questions, and programs want to showcase the highlights of their culture, right? They want you to know these things. So if you are ever uncertain, ask questions. They would love to promote and show you how these things align. You can ask residents things like, what is a memory from your intern year that really reflects your program's values, right? Like ask them from their perspective. And then ask faculty things like, can you tell us about a time when the program supported a resident through a tough personal time? What does feedback culture look like in this program? Just start thinking about the ways that you thrive and the way that you learn, and then ask those questions as part of it. Most programs will host pre-interview socials or day of socials or post socials and some kind of social event. There should be an opportunity where you get to interact with residents and just residents, right, as part of that, so you can get that sense. Those are great times to get a sense for how that looks and how that works. And then I think really trusting your gut for that sense that you get. Programs that really value these things, transparency, organization, kindness during your interview day, they carry that forward into their everyday, what you see on interview day as to how that collegiality between different individuals, this is what they're doing as part of their life and how they train their residents. Look to see where you see your values aligning with their values. And I think this is how you can get a good picture for that alignment. And I would love to hear also how program directors would encourage that. But I think our program directors do a fabulous job showcasing that to our applicants.
That was so helpful. Thank you. Just in the interest of time, we're going to keep moving to a couple other questions. I know you already spoke briefly about how to address the red flags in personal statements or other places. So if you could just touch upon it
Dead on.
again.
Dress them dead on. If you know there's a red flag, please don't think that you're going to slide it by, because I promise, even if you slide it by during the interview, we're going to figure it out at some point and we're going to have to ask you about it. And it makes it so much more awkward. I would say, so this will be my fourth year, my third year to interview, my fourth year to interview, my third year to interview actually. And only one time in all of my application review and interviews so far have we missed a red flag that we caught the day of the interview, but after the interview and went back to ask the applicant. And the fact that they hadn't mentioned it during the interview and hadn't talked about it on their application definitely moved them down our list because we felt they were trying to hide it. And that in and of itself is problematic. You guys, most of us have had hiccups along the way. Most of us in program leadership ended up in program leadership because we know what it feels like to struggle a little bit and we want to make the path easier for other people. And so maybe I shouldn't say most, but certainly I've had that experience. And I know lots of program directors who have similarly had stages of life where they struggled and chose to stay in education because it's meaningful. So just be honest.
Thank you for sharing that. And then I'm going to say, I think if it's okay with you, we should just skip this question because I think we covered it pretty well earlier. So we'll just move right along. And then kind of to round out our question series, Dr. Conser, if you could speak to what's one piece of advice you wish every applicant knew about the process. And I'm hoping that our other two panelists might be able to weigh in after, and then we can, with the remaining few minutes we have, just move into a few questions if there are any in the chat. So go right ahead.
No, absolutely. It's so hard to narrow it down to one piece of advice. So I'm going to do my best to try to make this like an amalgamation of a couple things into one. I like to just sort of frame this in the sense of there is no perfect pediatric applicant. I think a lot of people try to fit within this box of exactly what a pediatric applicant should be. and to their own detriment are not a genuine, authentic version of themselves, that they would be the most outstanding future pediatrician. My example would be I have students come who have different experiences. Like I have one student that worked in the music industry for 10 years prior to what they were doing, and they didn't want to include that on their application. But I think it brings such a rich history to who they are and what they still enjoy doing a little bit as part of their balance and wellness is doing music, but that's part of what gave them the skills that they have going forward. And then I also would tell students in the same way that I just responded to, how can a student get a good sense of a program's culture? I would flip that around and say, program directors are really trying to get a sense of your values and how they align, right? And so this goes back to that piece where I was saying, know what your values are so they can understand what they are and know how they align with the program, right? Do that self reflection and understand what you're bringing. And when you put that in an application, I promise it will shine through. I think a lot of applicants worry that when they put together these 10 experiences, they're doing all of the things that the program directors aren't going to be able to sense the full sense of themselves. But I think my colleagues can speak to the fact that they really do get a good feel through the entire process from start to finish of the types of applicants that they're seeing and who they are and what they're about and if they're a good fit. And then finally, I would say just be very authentic as part of that and trust the process.
Good advice. Authenticity, I think, is key. Also, take a deep breath, have some fun. It is hard to because you desperately want someone to want you in their program, and I know that's how you guys all feel, but I'm not gonna lie, every year I go in to recruitment, I'm like, "Oh, I hope that people wanna come and be in our program," right? Like, I think it's a bi-directional, like, "Please like us," and I think it's, like, almost like m matchmaking, right? So you sort of have to know what you're after. Nobody wants to recruit you to a program and have you be unhappy there. And so your goal should be to pick the program that's going to satisfy sort of your basic needs and then, sort of help you develop into the doctor that you want to be.
I agree wholeheartedly. The match rates are really high for people going into pediatrics. And um, I do want to acknowledge that there are different rates for our US medical graduates versus IMG graduates, and there is a separate FPR series for IMGs. So I will caveat this with the data is a little more robust for the US medical graduates, but not only is the match rate high, but that match rate in one of your top programs is really high. So it's gonna be not just okay, it's gonna be great. Trying to enjoy the process. I know it probably feels like that's a crazy word to suggest, but it's a cool opportunity to see all these programs around the country and to imagine yourself joining a pediatric family somewhere. So try to enjoy it.
Thank you all so much for that very, very wise advice for all of us here tonight who are learning so much of all the kind of inspiring information that you shared with us. So, on behalf of all of us, thank you for taking the time to explain all the different aspects of the application to be aware of and kind of really set us up all really well to go forward. Um, I think we have time for maybe one or two questions from the chat. So I'm seeing a question. Do you have any special advice for couples matching with one person of the couple is in pediatrics? If anybody wants to speak to that, and then we'll probably have time for one more.
Make sure you
I'll tackle that. Oh, go ahead. Sorry.
But just make sure you say your couples matching. I have to say for us, we always want to know if you're couples matching and then what your partner is trying to match into. We do in Oklahoma try to help facilitate at least an interview for the partner. So I do think it's important that you make it known, at least for us, that your partner is couples matching, and then we will always ask you if they've gotten an interview or not.
Oh, I think that's great advice. The other thing I would just add in as advisors is it's really important to have very thoughtful, targeted meetings about couples advising. This is where you want to get to know your advisors well at your home institution, or find some really trusted advisors in medicine who have a lot of experience doing this. And then I think it's going to be really key that everybody is very authentic and transparent, both individuals within the couple, and sort of lay it all out on the table and have some tough conversations about all of the different scenarios and things that can exist. But this is where your home advisor can be super helpful, particularly within your student affairs realm, because they may have a lot more experience with specialties outside of pediatrics, which it sounds like one individual within this couple would be in peds and the other might be in a different specialty. That's where that advising really helps. And so that's what I would do, is lean into your advising at your home institution.
I concur. Lean into your advising.
Thank you.
Truly.
And then just finally, I know we do have an upcoming IMG webinar, but just because there are probably applicants here who are starting to think about creating a program list, if anyone would just feel comfortable talking about, if just anecdotal data, if you know about the difference in the number of applications that might need to be submitted as an IMG applicant.
I don't actually know the answer. Do you, Megan or Elizabeth?
It's so I think one of the challenges with the kind of lump bucket of IMG is it can mean a lot of different things. So IMG can mean I am a US citizen who trained at the University of Queensland, and I did 2 years of pre-medical training in Australia, and then I did 2 years of all of my clinicals in the United States. Or I trained in a school in the Caribbean, but I did all my clinicals in the United States. It can also mean I graduated from training in another country 10 years ago, and I've been out of clinical practice that entire time, and I haven't been seeing patients. Those are two very different applicants, and so it's hard to have a one-size-fits-all approach, and I realize that that is frustrating, and that many of our IMGs have the disadvantage of also not being currently in a program that can provide them that individual level advising. Maybe to get to the questions about multiple attempts at step one, I would be lying if I said that a failed step didn't have some impact. If you've ultimately passed your steps, then certainly there is a really good chance of getting a match. If you have multiple fails for each step, that's coming together to the holistic application, and it is not a deal breaker, but it just depends on sort of what the ultimate outcome of the step exams are. And again, in keeping with that, to the question about not having any publications, we're looking for well-rounded. So if you have all these other things but don't have a publication, that's not a problem. If you have everything is glowing and you have one failed step and every exam has been passed otherwise, that's fine. It all comes together to a sort of this holistic picture.
I agree with that. I would also say if you have failed step one once, the goal would be not to fail step two if you haven't taken it yet. I think multiple fails on multiple tests starts to create a pattern. I also think it's important to write about it. So if you perhaps had a failed step and then were diagnosed with ADHD, or maybe you had a traumatic experience around the time that you had your failed step, it would be important to talk about that in somewhere in your application, because I do think that that matters. You don't have to tell us your medical diagnoses, but I do think that it does matter to us what the associated experiences with the step failure are. There is a question here about letters of recommendation, and I'm going to just jump on it quickly because I personally do not love a letter of recommendation unless it is personal and tells me something interesting about you. So if you submit 6 letters of recommendation, or whatever the limit is, that are all impersonal sort of form letters, that is not helpful to me. What I want to know is someone who has, witnessed your performance, preferably in the clinical setting, and can say something meaningful about your performance. It doesn't even matter to me if they're a pediatrician. It is possible you didn't decide to do pediatrics until just a few months ago. And so I think it is perfectly acceptable if it is from, and I think my letters were from an internal medicine doctor and maybe one pediatrician and a psychiatrist or something, right? I mean, it was ages ago, but I do think that the letters in general for me are less important, but they're more meaningful when they're personal, when they can say something about your performance.
I would totally agree. And I think that that applies regardless of whether I know there's a specific question about whether these need to be from US physicians or international letters. I think if you have a strong clinical international letter that says a lot about your clinical performance versus a short letter from somebody that you did a week-long observership and didn't actually get to see you in action, I would definitely recommend the letter that can speak to your clinical skills in a more robust way. And another shout out to the IMG mentoring webinar. Most programs, just as a ballpark, most programs do recommend 3 to 4 letters. Some do require a version of a chair's letter or a departmental letter. Not a ton do, but
Not very many
it's
anymore.
good to, if you have a top 10 place that you're going to be devastated if you don't get an interview at that location, it's probably good to go now onto their website to look at whether there is a requirement for a departmental letter so that you can ask your letter writers sooner than later. Yeah.
Just in the interest of time, we do want to respect everyone's time, both speakers and participants. Thank you again so much for all of your advice. We learned a lot tonight, which is very appreciated. To everyone who's attending the webinar, thank you as well for coming and supporting FPR. As we have on the screen, we have multiple other webinars coming up, especially in the next month, and hopefully should help answer a lot of the questions we had outstanding in the chat. So please use the QR code or visit our newly revamped website at FuturePedsRes.net. We added a lot of resources. And again, you can find that registration link for the webinars, but those should also be very helpful as well. So we hope to see you at future events. We hope you enjoy looking at the information on our website, and please reach out if you have any questions or other concerns that we can help with.
Thanks, guys. Good work.
Thank you so much.
Awesome job. Thank you all so much for your leadership.